When treating a protrusion, you need to address not only the causes, but also the consequences. That is, regarding the cause. You need to change your lifestyle so that it isn't sedentary. This means doing physical exercise, specifically therapeutic exercise. You also need to take breaks during work. If you have a sedentary lifestyle, you should get up and stretch every half hour, or at least just walk around to prevent stagnation. By the way, I didn't mention that not only the nerve roots are compressed, but also the blood vessels that supply the spinal cord, which leads to swelling. This also needs to be addressed. It is essential to do exercises for the spine so that the muscles, which are constantly tense, can also relax. Therapeutic exercise should also be done. The first sessions must be supervised by a physical therapy specialist, because not everyone can do all the exercises. Here, it really is necessary to take an individual approach to each patient. Massage as well. The massage should be performed by a specialist, because a specialist will identify which points on a person, which areas of the body are more tense, where there are trigger points, and where there are muscle clamps. In other words, all of this needs to be worked through, and an individual approach should be taken with each patient. These same points can also be found on the limbs, and they also need to be addressed. The approach should be comprehensive. It is necessary for the patient to undergo spinal traction, as we do in our clinic. We have a Sanmi Relax dynamic traction table. It allows us to work on each section of the spine all together in various ways. And this is painless and even, I would say, pleasant, smooth and gradual. And of course, the shockwave therapy method. The most advanced method, the most modern conservative treatment for protrusions is shockwave therapy. With this method, a shockwave is applied to the affected area of the spine and to the muscles surrounding the spine. As a result, tissue nutrition improves, drainage improves, tissue elasticity increases, and thus the size of the protrusion ultimately decreases. And naturally, the compression of the nerve roots is reduced. If there are pronounced neurological symptoms, then it is also necessary to address the neurological manifestations, that is, to work directly with the affected nerves themselves. This includes B vitamins and various medications that nourish nerve tissue. When exposed to shockwave therapy shock acoustic waves, the inflamed cells are destroyed and replaced by new, strong, viable cells. The growth of capillaries, elastic fibers, and collagen fibers improves, which creates excellent conditions for the patient's recovery. You should come 5 to 7 times, once a week. During this week, the destroyed inflamed cells and tissues should be resolved and replaced by new, young, viable ones. That's why it's not advisable to come more often. But coming once a week like this allows what we've broken down, so to speak, to be absorbed, enter the bloodstream, and for new tissue to grow. In the intervals between procedures, that is during the week when the patient is not here, the patient performs exercises that we personally recommend and demonstrate specifically for this patient and for each section of the spine. Of course, it is preferable to do exercises for all sections of the spine, but that already depends on the patient. He must listen and follow the doctor's instructions, because no one will do the exercises for him. The muscle has to work. Osteochondrosis, protrusion, herniatis are the price we pay for civilization, for a sedentary lifestyle. Animals, as a rule, do not develop such conditions at all. That's why it's important to stay active.